Obamacare is going on trial today. This is a big deal. This is the Fifth Circuit Court of Appeals, a very conservative court. This is the basically the southeastern district of the United States. And two of the three judges who are going to hear this case are Federalist Society members, just like this judge who back in November of last year in, I believe it was in Texas, ruled that Obamacare is unconstitutional. Now, the rationale that they're using, and this was 20 states, 20 Republican-controlled states that sued collectively with the state of Texas. And so it's Texas versus United States is the case. These 20 states, these 20 Republican-controlled states, and then when Trump ran for president, he was supportive of this. When he became president, he was supportive of this. And these 20 states, the argument that they made is that the Obamacare's individual mandate, in other words, you must buy health insurance. The original argument they made was before the Supreme Court back, in 2012, was that that mandate was unconstitutional. There's nowhere in the Constitution where it says that the government can force you to buy a product from a private company. So John Roberts split that baby in half in a 5-4 decision in which he said, no, that mandate is not actually a mandate. It's not actually requesting or requiring you to give money to a for-profit insurance company. It's actually a tax. And the Constitution, Article 1, Section 8, and elsewhere, clearly defines the ability of the government to lay taxes. And that was how they maintained the Affordable Care Act. That's how John Roberts avoided blowing it up. So then, in 2017, in Trump's tax cut legislation, because Trump hates Obamacare, right? He campaigned against it. He wants to take away, what little health insurance you have. He and the Republicans. I don't know if it was him, but the Republicans put into the tax cut legislation a provision that reduces the penalty for not buying, not buying insurance to zero. So the argument that the states are making now, today, in front of the Fifth Circuit Court of Appeals is a tax of zero is not a tax. And if you're still on the books, if the law is still requiring people to buy health insurance from private companies, A, that's definitely not a tax because there's no tax. It's the penalty has been reduced to zero. And B, if that part of the law has been invalidated, then under the Constitution, the entire law has to be invalidated. Now, that's a constitutional argument that's pretty sketchy. But, 2 out of the 3 judges are right-wing Republican appointees to the Federalist Society, which has been, championing this forever. The Federalist Society, heavily underwritten by right-wing libertarian billionaires who don't believe that Americans should have health insurance unless they pay for it themselves with the money that they inherited from daddy. So, and if they rule against Obamacare, or frankly, if they rule in favor of it, it's probably going to end up before the Supreme Court. And if the Supreme Court takes it, the decision's probably going to come down at the end of the 2020 term, which would be July of 2020, just 4 months before the election? 3 months before the election, 3.5 months before the election, which is just going to throw things into chaos, particularly if they blow up Obamacare. And what would happen? No more federal subsidies, which means that the Obamacare markets would collapse. So the cost of your health insurance is going to explode, number one. Number two, no more federal funding for Medicaid. Now, 3/4 of the states have now expanded Medicaid, so the people, the working poor, the Medicaid expansion is not for poor people. Those people already have Medicaid, making under $3,000 a year. It's for the people that make more than $3,000 and less than $15,000 a year, basically. It varies from state to state, but basically in that spectrum. In other words, the working poor, the minimum wage workers, they will suddenly lose their health insurance. And that's going to be something like 18 or 19 million people. And then the insurance companies will once again be able to put lifetime caps on the payouts if you get really sick. They will once again be able to kick you off your insurance policy if you get really sick. They'll be able to once again say, oh, well, you had cancer before, so if you want to have a health insurance policy now, it's going to cost you $25,000 a month. rather than the $250 a month or whatever, $1,000 a month that we would charge normal people.